I moved here from New York by myself. I didn't know anybody here in Baltimore, and so I was definitely very nervous. Residency is clearly going to be a very difficult time in our lives, and I felt nervous not having any social support here, but definitely my Med-Peds family has become truly a family to me. My three friends here who are also PGY3 Med-Peds, they are my closest friends who I can turn to for anything, that we have dinners often, that we go out hiking, camping, all of the above. And on top of it, there's of course the friends that I've made on the categorical sides too, where I do truly feel embraced by both sides and have just wonderful coworkers on either side. Then we have our switch dinners that we have as a Med-Peds family, and then we have our firms on the internal medicine side, which is another family unit in of itself. A lot of competitiveness between the firms, not always friendly, but that's okay because their firm really is the firm that excels above all. And then on the Peds side, we have our Peds families where we all have group chats and we hang out, have dinners together, go to different events together. So I just feel I encourage anybody who is scared to move to Baltimore, even if they don't have friends and family here in the area, because Hopkins truly has become a wonderful, supportive community that I've needed throughout residency.
Something else that I really enjoy about the program is our social events where we get to do Med-Peds switch dinners. Every time we switch from internal medicine to pediatrics or the other way around, our residents get to get together, enjoy dinner together, and also provide each other with advice as we switch from one department to the other.
So my name's ANDREA SILVAS and I am a Med-Peds intern. And what do I love about this program? Well, I think from the beginning it's just been amazing support. I think that's been the first thing that stood out to me. I struggled a lot with just like increasing anxiety when I first started the program, and just like from the beginning everyone just like wrapped themselves around me and provided me with like all the opportunities that I needed to be connected to like mental health resources and everything that I absolutely needed. And so that's been probably the thing that has stuck out to me the most, just the amount of support and love and like affirmation, and just like I am not alone in this place at all, and it's been absolutely amazing.
We have a great group of residents here in the Med-Peds program, and I'm continually kind of in awe of my colleagues, and it always feels like we have really big shoes to fill from the upperclassmen. They just are all really incredible doctors. And I have already grown very close to my intern class as well, so there's definitely a huge sense of community. In planning to come here with a family, there were a lot of things that I had to figure out before even moving to Baltimore. Things like childcare, who was going to be my daughter's pediatrician, what kind of things we were going to have in place before we even moved to Baltimore. And the leadership was really good about directing us in certain ways and helping give us recommendations for how to get our stuff established before we got here, since that was really important for us.
I mean, it's been a hard experience in the transition, but being in an environment where there's really a group of people that's supporting me and letting me know that I can get through these challenges, and knowing that I'm always safe in the decisions that I'm making, it's really been something that's been comforting in this really hard beginning journey so far. And then really feel part of bigger and a larger family. The urban health program for internal medicine is only 4 interns a year, but we're part of the greater class of 50 in the categorical program. And throughout my time on the inpatient side, I've really felt the exact same as everybody else in the program. And it really adds a layer of complexity and diversity that I really appreciate as part of this program. Not only in being part of the like-minded individuals in my urban health cohort, but then learning from the people in the categorical program that really have a wide range of interests, and we're really able to mix and share those ideas because we can bring some of the categorical people over to our urban health rotations and can learn from a lot of their other interests as well.
I remember receiving my match day envelope and being absolutely terrified, first and foremost, that I was coming to the LOESER Hopkins residency training program. Definitely had a lot of imposter syndrome the first couple of weeks. And what I have learned since then is that the people here are super kind, friendly, willing to let you learn. my very first day on the rounds, ACS rounds, I was pimped on an EKG very formally. And what I remember about that experience is not like how scary it was, but it was the fact that my co-interns were actually cheering me on through that experience, being like, you did a great job finding the QRS.